12:31. I almost made it on time today. So that's kind of a star, right? All right, welcome everybody, and welcome Dr. Sarah. This is Tuesdays with Dr. T, where I help you live your best life. And how do you do that? By being well informed about the options that you have in medicine. So I interview experts in their field and help tie in some of the patients that we may share so that you have more time with your doctor, getting to know your doctor, and even potentially have a new doctor. So we're open for new patients. You are more than your feet. You are more than your medical condition, and you deserve more than 7-minute appointments with your doctor. This is personalized care, and this is direct care. And so I want to welcome Dr. Sarah Pospos. Did I say it right?
Yes, it's perfect. Thank
I'm
you so
so
much,
glad.
Aditi.
I'm so glad you're here. Okay, so first off, you're a psychiatrist in Bakersfield, is that right?
Mhm.
Bakersfield, California. So we got another Californian, which is, I feel like it's getting harder to get Californians together. And I don't know why. A lot of my meetings, they're like on the other side of the world. It's on the other coast. So I'm trying to draw in more attention back to Californians. So I'm really, really excited that you're here to talk with us about what you do. And so tell me about yourself. How did you get into psychiatry? And tell me more about the benefits of what you offer.
Yeah, absolutely. And thank you so much once again for having me here today. It's such an honor. So, as you mentioned, I'm a psychiatrist, specifically sports psychiatrist here based in California. How did I get into psychiatry? I've always been interested in psychiatry ever since med school. I personally think that it's such a privilege to getting to know another person, in such a deep level. In psychiatry, we can spend up to an hour in our first visit, so we do get to know each other in that. In a more personal basis in that sense. I also think it's such a privilege to witness the highs and the lows of another person's life, and especially to be able to be in the position to help them during their lowest of their lows. I love that about psychiatry. And in terms of what I offer, currently I'm in my private practice. I offer telehealth visits, which just means that you don't have to be there in person for your psychiatric care. And I'm currently also on an insurance base, which for you, for the patients, perhaps it means that it adds more convenience and also confidentiality and the ability for you to get a more personalized care in that sense.
That's so important to point out. And I hadn't even thought of this because I'm also a insurance-free practice that's direct care because it allows me to give more time and more attention and personalized care to patients as well. But I hadn't even thought about that every time you use insurance, it's not really privatized. You still submit information about your medical health to somebody in order to get paid. So that sounds like a huge benefit to not be bounded by insurance, because then now you don't have to submit any of these private information to a third party payer to get paid. So that's a huge benefit.
Absolutely. And especially, for those who down the road might consider things like getting disability insurance approval or life insurance approval, perhaps, if you're having insurance-based care, perhaps just keep in mind that all your medical records, medical data is tied permanently to that insurance in that way
Oh
for that
yeah.
purpose as well.
I hate that because they can judge you on whether or not they want to pay you, or they can actually hold you back from employment situation because one day this information might be sold, kind of like the information we give to Facebook. That information can be sold, and ew, I don't want to open that box of stuff, but so
Right?
let's pull it back in because that is a whole nother drama series.
Agreed,
So
agreed.
I was so interested in learning about how you take care of athletes. And you talked about helping athletes overcome limitations or really how to excel in their performance. So can you talk about why is treating athletes so different than maybe another population?
Yeah, absolutely. So first, I'd just like to point out, typically sports psychiatrists, psychiatrists who specialize in treating athletes, be it aspiring athletes, current athletes or former athletes. Typically, they're also former athletes themselves. With that being said, they're probably more familiar with the unique challenges that an athlete may face or how the sports are run procedurally in that sense. And that could include things like choking or performance anxiety in sports, burnout in the context of overtraining, and things along those lines. Also, we are trained in focusing on the nuances when prescribing medications to athletes when needed, of course, when indicated. So, for instance, some medications, some of the concerns that an athlete might have is taking a medication that unintentionally was prohibited in their sports. So, for instance, a beta blocker, which could improve tremor, is actually prohibited in sports like archery or shooting, those that focuses on fine movement. Also, some medications might have unique side effects, such as weight gain, for example, that could impair an athlete's athletic performance in certain sports, as well as their safety profiles as well. So I believe it's very important if you're an athlete to take this into consideration when finding psychiatric care.
So it sounds like you're an athlete.
I used to.
What was
in
your
another life.
sport?
I used to play I used to play basketball and volleyball back in the days.
Oh my gosh, I think it's so important to have a doctor that can connect and be where they used to be or are going to be. So I
Right,
didn't know that
right.
about you. That's very cool to share. So you talked about choking, and I feel like this is a huge topic because every single time, my husband and I are watching football and we're like, that looks like it could have been easy. Why did he drop the ball? And so on. But there seems to be like a deeper layer of choking of why people don't perform at their best. Can you talk a little bit further about why do athletes choke? What is the psychology behind that?
Yeah, absolutely. So, choking, or we could also phrase it as, for performance anxiety, competition anxiety, in the context of sports, just like performance anxiety in general. So when people take tests or when people perform on stage for singers and things like that, we have this focus on being judged, right? Being evaluated, and that anxiety is perceived in our body as a threat. Back in the days, the threat is a legit survival threat, if I may phrase it that way. So let's say during our hunting days, when there's a bear, our survival is being threatened, right? That's why it creates anxiety in our brain, and it translates into a whole number of physical symptoms like increased heart rate, increased respiration rate, increased muscle tension, and things along those lines. So it's similar to this context, the performance anxiety in sports, and it could create a whole of mind and body symptoms. So perhaps an athlete might find it harder to focus, to concentrate on doing what they're supposed to do. Then they might have other physical symptoms like heightened heart rate, heightened respiration rate, muscle tension that could impair their coordination and things along those lines. So it's common. It's very common, and it could definitely happen to any one of us in terms of impairing their athletic performance too.
Is that something that can be defined? Like, how do you know someone's choking or has a performance anxiety that has led to them like not shooting a score? Or, like how is that defined or is that subjective?
Very good question. So a lot of mental state or mental condition in psychiatry is very subjective in that sense, right? Um, the person who experienced it knows most in terms of the level of severity. But in general, for psychiatrists, we consider something a problem when two things happen. First, if because of the symptoms, someone experienced intense, severe distress, or second, if the symptoms interfere in any way with their day-to-day function. So that could look like impairing their grades, their work, their relationship, and in the case of athletes, their athletic performance. So that's when we consider it quote unquote disorder, and someone could benefit from professional help
All
with
right.
that
So
stage.
it sounds like a scary place to be when you're expected to perform at a really high level, what you've been training all of your life and career to do, and then suddenly you freak out a little bit. So how would you treat an athlete? Is this like a staged approach? Is it medication? Is there other processes to help an athlete perform at their best?
Yes, so like in anything in medicine, right? It's a case by case basis. But in general, the approach that we take is we take a look at the symptoms and the severity first, right? If it's on the milder side, we have more options. Perhaps, I would prefer to start with or the safest, so to speak, treatment first. So we could consider something like talk therapy. CBT or cognitive behavioral therapy is one of the most well-researched therapy in psychiatry, and could be utilized in this condition as well. It's very much effective. We could teach them things like relaxation techniques, deep breathing, visualization, imagery, things along those lines to help out as well. And then if the symptoms is more severe, then when indicated, of course, we could consider medication therapy, which could look like anti-anxiety or other type of medications too.
So not just one way. Lots of
Absolutely.
ways.
Yes, for sure.
That's so interesting. Is there something you want your medical colleagues to know when it comes to treating athletes? Because I treat athletes all the time. I live in Santa Cruz. We have athletes from San Jose, the Sharks and the Warriors up in the Bay Area. And so I get people who are either entering into a professional sport or they're retired. I don't get them in between because they have like a sports specific athlete, but I get the variation. So are there things that I should be considerate of when I'm treating these patients in regards to their foot health? Because we have to maintain function, but sometimes I have to prescribe a steroid or do an injection or provide orthotics, or other various medication depending on what's going on. What are your thoughts about that? Like, what do other doctors tend to get wrong or get overlooked when it comes to treating these types of people?
Great question. So I think in general, as you probably can see in your practice, right, a lot of people experience psychological challenge, which could benefit greatly from mental health help. So I would say if this symptoms escalate to the point of creating intense distress or interfering with their day-to-day function, they could definitely benefit from a referral to psychiatrists or other mental health professionals, like a therapist as well. The other thing that I would like to point out is sometimes patients equate psychiatrists with pill pushers. I just wanted to underline that, as we talked about earlier, there are different types or options in terms of treatment, not just medications. And of course, we only consider medications if and when necessary as well. So I just like to keep that in mind for the patients as well, if that's one of your concerns as patients.
I have to say, I have that stigma because one of my rotations in psychiatry was a very well-known psychiatrist when I was in Michigan. And that rotation experience was exactly that. He would sit at a desk and patients would come to his chair and he wouldn't say more than a few words. And then a prescription would be handed to the patient. And it was just a very, it felt like a very cold experience for me. And it really turned me off. And that's how I came to understand why they're seen as pill pushers, because that was what I was witnessing. But it seems like in this generation, we are more aware and are more open to speaking about mental health as it's just part of who we are as humans. It's not something to stigmatize anymore, or we're trying to destigmatize that with less medication, because we know with medication, not only is there expense and things like that, but there are side effects. And it may not really get down to the problem, which might be really a mindset sometimes, just their point of view of what they're seeing, how it affects them personally. So I'm wondering, do you encounter people who self-identified as an athlete, but suddenly their career, has ended, or they're retired, or they got injured, or whatever, and they are no longer an active athlete, maybe a retired athlete, but are there points where they struggle with that identity, where they're no longer that athlete? And I think about this when I don't know if you ever watched Married with Children, Al Bundy, he always talks about how he scored however many touchdowns in his high school days, and he's always living back the glory days, but he doesn't really get a chance to move forward in his life. Is that like a thing to be aware of with athletes, the identity that they have?
Yes, I'm so glad you brought it up. Actually, that self identity, right? How much or how strongly they associated their identity, their personal identity, to their athletic identity is definitely a huge factor, and especially when retirement comes to play, and especially again if it's unintentional retirement, right? Let's say if someone were forced to retire because of season-ending injury or other causes. So that part of their athletic identity is one big factor. The second big factor is for a lot of these athletes, exercising or their sports is their main way of coping with stress. So when that get taken away, especially unintentionally, their main coping skill, so to speak, is also taken away. So that's also creating a huge stress and unintended effect as well in their mental health too. So definitely that's such a big factor with regards to their mental health in general.
That's huge. That I didn't even realize that that is part of their coping mechanism to be the athlete, to do the physical things. That I can understand that. I can be more empathetic about that. I often get patients who say, I used to be really athletic, but that was like remote. That was like 30 years ago, but they continue to live as if their body is still that 30-year-old version. And
Mm-hmm.
so they're looking for, maybe that one magic pill or that one shot or that one treatment to help them be their 30-year-old version of themselves. But I have to be the one to break it to them and say, but you've aged 30 years. Your body has different demands. What you eat changes too, like your ability to tolerate certain foods changes even. And that also affects your mind and your body. And so I always feel kind of like an empty space where I don't have the background to really help patients arrive to the point of today. They keep living in the past, and it really affects how they're living right now. I just had a patient who said, I just want to not have foot pain like I was in my 20s. I would just bounce back. But here I am, I'm the bad guy saying, I'm sorry, but genetically speaking, time is not on your side. We have to really account what your activity level is today and what your body can tolerate and recondition to get to a better place. But it's very possible you may never get back to the place that you expect it to be. Wouldn't you say
Mm-hmm.
that's a realistic expectation? Like, how do I soften that? Is there a way to soften that? Should I be more straightforward about it? I don't know how to approach those types of very, very hard conversations.
Definitely, it's very, very difficult conversation, especially like you mentioned, if they're still in that space, right? It's very hard for us as a quote unquote outsider to help bring them to that realization or that space, especially in one encounter or several encounters in the context of doctor's visit as well. Um, my tip would probably just be in general validating their distress, right? Like what you've been doing, and then just like you said, just being empathetic with their concerns in that way, and then if and when they're ready to kind of transition to that mindset, and then of course offer the resources in a more uh, direct way, perhaps.
How do you help somebody be ready, I guess, to have that? Or do I just respect it and just move on? Like, I feel like
Right,
that's the
right.
answer.
Great question. One thing that comes to mind, I think, is techniques from motivational enhancement. So we do that a lot. We do this a lot with someone who's trying to quit, for example, tobacco or trying to quit drinking, but they're still ambivalent in a sense that they're still not in that place where when they're ready to make the decision to quit. So the first step, would always be to address their ambivalence, right? In this case, and then once they're moving to the next step, and then approach it in a different way, meaning starting to give them more information on a cognitive level for them to see the pros and cons, perhaps to quitting, or in this case, to accept, that they're not in the same spot where they are 20 years ago, 30 years ago, and then take it gradually from there.
Is there What is the major difference between a psychologist or a therapist to a psychiatrist? How would one know which one to go to when they are dealing with some mental issues?
Yes, I'm also so glad that you asked that questions because that gets asked a lot. Um, so a psychiatrist, for everyone out there, is a medical doctor who finished medical school and medical training, of course, and then specialized in psychiatry or in mental health. So we do deal with common, for example, mental health conditions like depression, anxiety, PTSD, and things of the sort. Uh, versus a psychologist is someone who studies psychology in school and then might practice um, as a therapist or as a psychologist. So therapist is also a common term. It could mean that someone has a psychology background, but it could also mean that someone has a social work background. So therapist essentially deals with providing therapy. The type of therapy depends on the therapist themselves. So it could be CBT, cognitive behavioral therapy. It could be other types of therapy as well, interpersonal therapy. The list goes on. Versus a psychiatrist have the options of doing therapy plus prescribing medications as well if needed.
So somebody, because the stigma is still very real around medical stuff. I don't even know what the proper phrase is because we all have mental stuff, right? We all deal
Right.
with it. It ebbs and flows, but we shouldn't feel bad about those ebbs and flows. So,
Mm-hmm.
how do you, I guess, kind of convince somebody that psychiatry is a good option rather than feeling like they're a failure because they can't moderate their own emotions?
Yes, for sure. So, like you said, we all, as humans, have our ups and flow, our ups and downs, right? And during our downs, it's kind of hard um, to see things objectively, so to speak. So, I would say the main signs would be those two. First, if your mental state or your feelings cause you severe distress day to day, or it caused some sort of impairment in your function, your relationship, your work, your grades, um, anything in your daily life. If you or someone, a loved one notice that, then it's perhaps times to seek some help because, like you said, mental health is part of us. Mental health is just as important as physical health. So, that way you don't need to suffer alone and can hopefully get back to where you were before when you feel well.
I think that's really important to highlight that we don't have to suffer alone because we are all suffering. We are on this gradient of suffering, and it's just this is the
Yes.
human experience. Unfortunately, everyone experiences it very differently, and we have to just acknowledge that it exists and then reach out when it's affecting your day-to-day life, it sounds like, right?
Absolutely. Absolutely.
Well, I am incredibly fascinated with your field of work. I think it's helping people in so many different ways. I don't want to end this, but I know I have to respect your time as well. Is there anything that you want to touch on that I might have missed in our conversation that you'd like to share with the audience?
I just wanted to mention again, if it's very hard to see things and get help during our lows of lows. But if you do experience the things that we mentioned earlier, please reach out. Help is just one phone call, one email, one click away. If you happen to be in California and don't have a local psychiatrist, feel free to reach out to me at lifestyletelepsychiatry.com. If you're not in California, I still do offer some free resources, additional resources at my website, lifestyletelepsychiatry.com/subscribe, or you can always reach out to Instagram as well with the same handle. And I'd also like to thank Dr. T and give a shout out. So if you're in California and you're experiencing any food problem, please go to Dr. T to receive such a great care.
Oh, thank you, Dr. Sarah. I appreciate you so much. I don't want this to end. I'm going to be in your DMs. I'm going to be asking you all the questions for my own benefit because I often encounter patients where I'm just kind of stuck. I'm like, I don't really know how to navigate this. I have my little area of expertise, and then there's like all these complicated parts about people. And I certainly want to try to do my best to at least bare minimum be resourceful. So I'm so glad you're on social media. I'm also on social media. And that will end our call today. Our conversation doesn't really end here. It's just going to end the live here. I hope to see everybody next week, next Tuesday. Every Tuesday, there's going to be something super fun to talk about in regards to medical care, medical access. You can also find me at Dr. T Podiatry on Instagram and probably everywhere else. And I think that's it. Thank you so much, Dr. Sarah. I appreciate your time. So much to learn, so much more to learn, I bet.
Thank you so much, Dr. T.